something like this, be ready for these situations, right? So the patient, that it's really difficult for me to lie down, for example, right? If the patient, follow the patient's clues, right? I'm intentionally doing that. I am giving her some hard time to see her reaction. No, doc, can you actually examine me like this? It's really not comfortable for me lying down.
Okay, I understand that it's so discomfort for you, but I would just like if you can try to just let us like
It's really difficult for me.
Okay, then it means I would just like to start it
later on. If my pain is getting better, I will try.
Okay, no problem. So I would like to examine. I would like to inspect my patients by looking for the level of discomfort and the level of any if there's any breathlessness. Then I will also inspect for any change in skin color and also any cyanosis.
The patient blood pressure at 145/95 every single time that you are starting your physical examination. Started with vital sign, comment on it or ask or any changes. Don't forget it, please. It's called vital sign because it's vital to be checked. Blood pressure 145/95. Heart rate is 92, regular. Oxygen saturation 92% in the room air. Pulse rate is, I said 92 and regular. Temperature 37.5. O2 saturation, I said. Respiratory rate 16 per minute.
And the blood pressure?
145/95.
Okay. So I'll start I'll check my patient's eyes. Can you please put down your eyelids? Yeah, I'm checking for cyanosis. I'm checking for pallor, and I'm also checking for any conjunctival.
No jaundice, no pallor.
Okay. Can you please open your mouth? I'm checking for any angular stomatitis, dental hygiene, and I'm also checking for.
Is it good? My dental hygiene. Acceptable.
So I also like to check. Can you please stretch your hands? So I'm checking. Okay, I'm checking for flapping tremors. So can you stretch your? So I'm checking for peripheral cyanosis, and I'm also checking for yeah. Can you please show me your palms? So I'm checking for any Janway lesions, and I'm also checking for Osler's nose. I'm checking for finger clubbing. Then I'm also checking for any distortion of the nails. So at the same time, I would like to palpate your pulse. Sure. Okay. So I'll do it for 15 seconds bilaterally. Okay. I'm checking for rhythm, rate, and volume. It is good. So I would like to also check palpate for your brachial artery. Okay. Yeah. So I will do that. Do you feel any pain in your hands?
No.
Okay. I'm doing collapsing pulse. So I'll raise it up. Good. So at the same time, I would like to, okay, I've checked the blood pressure and taken other vital signs.
Do you guys see?
Okay. So I would like to check the jugular venous pressure. Can you please look to the other side? Okay, I'm checking.
Ideally, I want my patient to lie down in 45 degrees, but the patient is in pain. Okay.
Okay. So then, do you feel any pain in your stomach?
No, another one in stomach, in my chest, doc.
Okay, so I'll palpate the abdomen to check for hepatojugular. Okay.
No jugular venous distension with palpating, but actually pressing the liver.
Okay, so I would like to palpate for the carotid pulse. I'll do it simultaneously.
Never check it bilaterally, okay? Especially in older patients.
Yeah. So after I would like to inspect my patient's precordium, the chest.
The patient chest is exposed for you for examining.
Yeah, I'm checking for any chest deformity or any scarification. So can you please raise your arms? I'm checking for lateral thoracostomy. Then can you please raise the second arm? Checking for the second lateral thoracostomy. So I would like to palpate.
Time is over. 1 minute extra.
Okay, I would like to palpate for
the major part, which is my heart and lung, is still left. Don't actually be careful about that. It's her first time doing that. She joined us very late, so I'm not actually picking on that much. I'm not trying to be actually harder than this. But basically, this is what the situation is. Be careful about this. So in a 4-minute station, then actually talking about Janeway lesions, what the other one, Osler node, these kind of stuff, right? You don't have time. I'm looking for any abnormalities. I don't see any abnormalities. I will actually come back later if I have extra time.
So I'll be palpating the apex bit to check to get the
Yeah, sure.
Okay. So
The apex plate is not displaced.
okay. So I'll be
Apex plate is in an actually mitral region.
yeah.
Fifth intercostal space.
Yeah, in the intercostal. Okay, so I'll be palpating for the tricuspid valve, which is also at the fourth intercostal space, left sternal region. Also palpate for the pulmonary valve, which is at the second intercostal space, upper sternal region. Then the aortic valve at the upper intercostal.
You don't need to mention it. You can actually
Okay.
just show APT. Yeah, as long as you're close to that region, you should be fine, right? As long as you're just covering the regions, right? Guys, all physicians take money, or all politicians take money, right? So second, you're actually moving to the sternal border, and you're coming to the nipple. It's easier from the nipple. If you start from the nipple area, right? I'm not flashing, but nipple area, right? This is actually the MTPA. All politicians take money. All politicians take money. They will not check exactly, right? They were not actually superficial markers. That as long as you are close, so you're not listening to my aorta here, that's fine, right? So APTM should be fine, okay?
Okay, so
and you don't need to mention every single details of it, especially in 4 minutes. You cannot have time to. You don't have time for actually explaining. As long as you're actually close to that region, I'm starting with actually close to the nipple area for mitral. I'm moving to the sternal border for tricuspid. I'm moving up for the pulmonary region. I'm moving to the right side for the aortic region. And I don't actually. You haven't listened to my heart yet, and it's still 5 minutes past.
So I'll be doing the parasternal heaves, checking for the parasternal heaves. Okay.
No sternal heave.
Okay, then the thrills and the four
No
points.
thrills.
Okay. So now I would like to listen to your chest.
Sorry, 1 minute or 2 minutes.
1 minute.
6.
Done. Finish. You're 6 minutes. Finish. Continue. Time. Actually, how much it takes?
Can you breathe in and out? Okay, breathe in and out. Okay, breathe in and out. Breathe in and out. Okay, so I would like to check with the belt too. Can you breathe in and out? Okay, can you breathe in and out? Can you breathe in and out? So I would also like to auscultate the carotid pulse. Can you breathe in and out?
No bruise.
So I would like